This meeting is being recorded. This meeting is being recorded.
So we just had a phone conversation with the lecturer. So she's going to join us very soon. She's just having some technical glitches, which are already being addressed. So thank you for your patience. Jazakumullah khairan. Please don't leave. Thank you very much for your patience. The lecturer is joining us very soon. While we are me also use this opportunity to remind us that this weekly webinar is open to all Muslims within and outside the country called Nigeria. So it's not just for members of NESFAT, because if you look at the we bring around for the speaks that are very germane, and they are topics that that concern every one of us. So we show them, ensure that we are regular in attendance. So let's talk to our colleagues at work, those who are Muslims, even those who are not Muslims. Everyone is welcome on board. The program is for every one of us. It's a forum where we learn about Islam, and then we learn about issues going on in our society from the point of view of Islam. And I can hardly figure out a particular week I was part of this webinar and I did not take away one or two lessons. It has always been a fulfilling and rewarding one for every one of us. So we want to urge you to continue to be part of this, and then tell your circle of friends and tell your friends, your family about the the webinar so that everyone learns. Guys, for this unexpected, disappointing situation, we apologize. Inshallah, very soon we'll begin the lecture, and together we'll be happy ultimately and fulfilled, inshallah. Just as we have this Sunday webinar, we also have Friday tafsir, which is also run virtually. So it is run on all our platforms, our Facebook account, our YouTube account, and then the other platforms, Twitter, and the rest of our platforms. So you can also join us around the same time, 5 p.m. every Friday. So it is another fulfilling session. Honestly, it's a nice time, with the Quran. You spend time with the Quran, then you have scholars who have knowledge of the Quran around to dissect the message of Allah subhanahu wa ta'ala in the Quran for us. So we do this on a weekly basis, and it takes place every Friday from 5 p.m. upward. So we'll be glad to have you there. So I've just been informed that even the lecturer has been speaking all along, unaware that she was not audible. We do apologize for this, honestly. We did not see this coming. But really sorry about it. Sorry, I think 3 core. The person has been raising his hand. Galaxy A3 core. Who's the owner of that phone? That account.
Hope Galaxy A3 core is not our guest speaker. The person should unmute and identify himself or herself, please. Galaxy A3 core raising his hand or her hand should please unmute.
It was a mistake.
Okay, sure.
Let me inform our distinguished guests that the lecturer has already forwarded in materials. And along the voice over. So inshallah, very soon the voice. Honestly, this topic is what waiting for. Is what waiting for. When I saw the topic, honestly, I said, wow. Times such as this, talking about medical compatibility in marriage. So we'll begin to share the material very soon. We have a lot of marriages that tons of money we're saying, spent. Hello? So I was saying that we have marriages today that a lot of money was spent to bring together, and most of them don't last. I think there is a problem somewhere, and then we need an expert, somebody who is informed about marriage counseling, about issues of marriage, to speak to us. We will have asked one of our imams who is also an expert in this field too, to be addressing all. So I think just to save time, we need to go straight to the materials without further ado. I'm almost done downloading. Alhamdulillah. Okay, a minute, please.
This is so funny. She can hear us. She's here with us. And she's been hearing all you're saying, but I don't know why we can't hear her.
And you, I will suggest that Imam Said speaks to the topic so that we
Can she try again from her end if she can speak out?
Yeah, I suggested that she should exit and then join again, and she has agreed to
She
do
did
that.
that. She did that earlier on. She was out initially, and there's been a network glitch. Seriously, 15 minutes to the event, I faced similar.
Yes.
Now,
yes. Please make Imam Olaguju a co-host. Make Imam Olaguju,
except he has gone out to come back again.
No, he's no longer a co-host, please. Make him a co-host so that he can share the materials, please.
I suggest that he move as our plan B so that he will engage the audience.
No, let's see what, I think before then, let's see what the main lecturer has prepared for us, please. But Imam Said, if you are there, you can start talking while we wait for Imam Olaguju to share the materials, please. Unmute yourself, please.
Yes, I am here, and Alhamdulillah Rabbil Alameen, wassalatu
She's
wassalam.
connecting. She's connecting.
Okay.
I saw a video earlier on, and I guess she's trying to get the audio connected.
Okay.
But you can keep talking, please. Keep talking.
All right. Alhamdulillah wa salatu wa salam ala ashrafil mursaleen wa ala alihi wa ashabihi wa sallim. Without any point of beginning, Allah is the last without any point of termination. We thank him, we adore him, we show gratitude to him. We pray that he will accept all our efforts as acts of ibadah. First and foremost, I want to join Araji to apologize on behalf of Dr. Khadija Adebale. She's here with us. She can hear us. I can see her on the panelists list, but unfortunately, she can't. She's been talking, but we don't know what's happening. We can hear her, but she can hear us. Dr. Adebale is actually a professional. She has been trained to handle issues like this. But I must tell you sincerely, I am not a medical practitioner. I am only a counseling psychologist. And by virtue of my sufficient enough information about medical, the evils that medical compatibility can cause, and the risk that compatible but decide to be blindfolded by love, to be carried away by love, the evils and the risk that are in there for them. I have, and inshallah, I'll be sharing some live experiences from sessions that I have had with couples that are facing challenges. Maybe this, inshallah, will suffice. I want to also seriously recommend that what Dr. Khadija had prepared. I know our the people in charge here are trying to share the slide with us, but I want to come and talk to us in depth as a professional. But I'll be sharing experiences because of the people that have joined us here today. Check the Quran, you may not find medical compatibility. If you check, wa alaikum salam. Is that Dr. Voice?
Alhamdulillah, finally.
MashaAllah, alhamdulillah, alhamdulillah. Now we can hear you.
I sincerely apologize to everyone. To forestall this, actually, since yesterday, but I think there's an issue. I'm a panelist, but I'm not a host. So for some reason, it's
no,
not
you're a host,
me.
ma. Check, you're a host.
All right, so I'm going to try to share my slides again. I can actually see my slides on the screen. All you need to do is just start the PowerPoint presentation from the beginning. It has a voiceover, so I have already recorded everything. can you see my screen as I'm trying to share?
Ajia.
Yes, please. I'm with you.
I want to suggest that because we are actually running out of time, maybe you can summarize what you have for us. We'll have the materials later in the day, and then we'll share them across our platforms, please. You can just give us the summary of what you are prepared for us. Thank you so much.
All right. Okay. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh.
I tried so much to avert it, but as Allah would have it, this issue came up. So when we talk about medical compatibility in marriage, we are looking at from living together in tranquility, according to Surah to Arum, verse 21, where Allah said He has created for us mates from among ourselves, so that we may live with them in tranquility, and He has put the love and mercy for them within our hearts. So in this, that will prevent us living in tranquility with our spouses. And there are actually many medical issues. But what I find most important is that confidentiality must be maintained. When you ask testing because they want to get married, you are going to open a can of worms. Some of them may not know they have some certain illnesses. And some of them have known before, and they have been managing their illnesses confidentially. But you're asking them to share this confidence with another person who may or may not decide to go ahead with the marriage. So this is a risk, and this puts people, it makes them vulnerable. So if people feel that they are vulnerable, and it cannot be guaranteed, then it is a failure. Because let me give an instance. So a man has HIV and he's looking to get married. To break the confidentiality, thinking in a misguided sense that she's doing that other sister a favor. And this will cause loss of confidence in the program. Also, there are some major issues that we have to look at. For compatibility, it is not a case of the missionary council deciding whether a couple can marry or not. It is an advisory capacity. So for whatever you see, you can advise that we do not advise that you marry, but you cannot compel them. And confidentiality people who are both AS, who are in love and want to marry, and you advise them otherwise, and they still insist to marry or their parents about what you consider as the wrong step that they want to take. Confidentiality is actually more and what are the tests that got? So there are actually a whole battery of tests, but we have it's important that you first have a screening checklist. And in this screening checklist, you want to know whether there has been, if the person is currently on any treatments. Somebody may have had schizophrenia 20 years ago. I'm talking about the nervous breakdown. The person currently has not had any episode. So the person will say in that checklist that they are not ill. However, the person is on medications. So if you ask that, are you currently on any medications? The person would have to answer that they're on medications. And that will help the counseling team to decide. Other questions that are of importance are if there's any history of cancer in the family, any history of hypertension, of diabetes, any history of sickle cell. It's also important that you find out if there's any history of alcohol or tobacco use or use of recreational drugs like cannabis. You may have to use the local names for these drugs because they may not understand it to be cannabis. The cannabis is the word, but other drugs of friction for them. So you have to ask. And appears to be a Muslim or a woman for that matter, and you find out that this person has drunk alcohol consistently for the last 20 years, that has implications. And the person maybe only recently stopped 6 months ago. An intending spouse should be allowed to decide if they want to go ahead to marry somebody who has drunk alcohol for 20 years and has just recently stopped, knowing fully well that there's a risk that that person might go back to alcohol. Same applies to tobacco, same applies to recreational drugs. You want to find out if there's any history of cancer in the family, because unfortunately,
Doctor, you may need to, Doctor, can you hear?
I'm with you, I can hear you. Hello, do you want me to stop?
Walaikum salam. I guess maybe he wants you to use your video possibly for them to see most of the information you are putting across through. I don't know.
Okay. How I wish my slides were up, but well, all right. I will switch my video on. Just a moment. Is this all right now?
Man, mashallah.
All right. So I'm just summarizing my talk. All right, so I was talking about some cancers being hereditary, and some are hereditary. For instance, breast cancer in women. So you find out that a grandmother has breast cancer, and the particular molecular signature of that breast cancer is what the daughter would have, is what the granddaughter would also inherit. So this is important. This is not to stigmatize anyone, but it's also, it helps to be prepared and also to take precautions. There are some other cancers that are also hereditary. Then you want to find out, are these two people who are hoping to get married, are they related? Because as Muslims, we marry our relations. We marry our cousins. We marry our cousins. We marry our second cousins. Even some of our parents are also cousins. I see my slides coming up now. Should we give it a chance? Moderator.
I guess we'll just talk through it quickly, and that will be faster for you to pick. Maybe you just you can
my
skip some
slides have been pre-recorded.
Oh, okay. Please go ahead while he's trying to sort himself out.
Okay, all right. So as I was saying, so So we call marriages between close relations consanguineous marriages, and they do have medical implications. So for instance, if I have a 1 in 5 chance of inheriting a disease, and because my cousin is from my same family, he also has a 1 in 5 chance. If we do get married, it means our children have double that chance of getting that disease. So their chance is a 1/5 plus 1/5. That's a 2/10. So that's so their own chance is their own chance of getting the disease. They have a 2/5 chance of getting the disease. And if they decide to get married to their cousins, then their own offspring have a higher chance, a 4/5 chance of inheriting the disease. What are the other important medical implications of marriages in Islam? Because we also do polygynous marriages, there is an importance that we have to look at human papillomavirus. So human papillomaviruses are actually quite many. However, there are about 6 variants or so that can cause cervical cancer or penile cancer for the man. And these viruses are actually sexually transmitted. So you see somebody who has not been sexually exposed, their chance of getting human papillomavirus that can cause cancer is 0. But the moment they get married, the chances increase. The moment they get married to somebody who has been previously married, the chances increase. If they also go on to a subsequent marriage, the chances also increase. So because of this, you also want to look at if the marriage setting is I'm not talking about the potential for polygyny here. I'm not as it presently exists. If it will be a polygynous marriage, then you must consider human papillomavirus. So if it is a young woman, especially under the age of 26, not previously married, she can go ahead to have the HPV vaccine, and she's fine. That's if she's going to a polygynous setting. But if she has been previously married and the man is also currently married, we're talking about a lot of sexual partners in this setting. It will be important for both of them to do the HPV testing. The woman can also do a pap smear. That will tell us if there are any abnormal lesions in the body that can cause cervical cancer. So when you have done all these tests and you've looked at them, it may also be important to do a psychological or mental health examination based on what you find. So you find a man that maybe, or a woman that the counselor believes may not be quite psychologically stable or not psychologically prepared for marriage. It would be good to have a psychological examination. Another important thing that we mostly overlook is fertility. In this part of the world, in a marriage, if there's infertility, there's a lot of pressure on the woman. And sometimes the man may actually be the reason why there's infertility. And to be fair to many of the men, they are actually not aware. And by the time they find out in marriage, it causes a lot of heartache and a lot of embarrassment. I think it is good to ensure that the man is able to impregnate a woman in marriage before he goes into a marriage. For a woman, you just do a cursory testing. What I mean by cursory is that you just want to ensure that the reproductive apparatus is present. That is, she has a womb, she has ovaries where the eggs are. But for the man, you want to see that he has the sperm cells and that they are viable. Another test you want to do is you want to see if they have sickle cell, because it is prevalent in this part of the world. 25% of Nigerians actually have the trait, so it's actually quite common. You want to find out if they have the traits. You also want to check for sexually transmitted diseases without prejudice to whether this person has been previously married or previously sexually exposed or not. You don't want to know. Everybody open to go into marriage must do a sexually transmitted disease knowing fully well that glaucoma is prevalent. After you have done the testing and you have counseled, you must do pre-testing counseling. You must do post-testing counseling. You must obtain consent. The couple may actually decide to break up the relationship if your health check comes up with issues that they do not feel confident to deal with, or they can decide to get married in spite of the major issues that come up, and you cannot stop them. They can also get treatment before marriage. Say, for instance, the HPV vaccine I mentioned earlier, or if one partner has sexually transmitted infections, this is temporary and can be treated easily. If one partner has hepatitis and the other partner doesn't, there's hepatitis immunization. So the other partner can get the immunization. They can decide to prepare for eventualities and still go ahead. And then they can decide to have medical intervention in the course of the marriage. For instance, if they both have sickle cell traits, they can decide to go for IVF and embryo selection, where embryos without sickle cell can be selected. And another important thing that should be done is the blood grouping. And I would like to talk about the resource blood grouping. An individual can either be resource positive or resource negative, resource D positive or resource D negative. What is most important is if a woman is resource D negative and she marries a spouse that is resource D positive, when she does get pregnant, if the baby has resource D positive blood group, you know this woman is resource D negative, so her body, she has no antibodies to resource. But the baby starts to throw up the resource antigen, so her body senses it as a disease and develops antibodies to tackle it. That is the normal thing that the human body does when there's a disease, be it a common cold, be it an infection. Our body develops antibodies all the time to protect us. So her body develops antibodies. Usually the first pregnancy will escape, but any subsequent pregnancy, if care is not taken and she doesn't get the right treatment, her antibodies will destroy that pregnancy, seeing it as a disease. And then you find out that she keeps having recurrent miscarriages. This is not a reason to say a couple is medically incompatible and they cannot go ahead with marriage. With this, they can get married, but when she does get pregnant, she can get an injection that will neutralize the antibodies that she has. Having said that, I will talk about the ethical considerations. The ethical considerations of premarital medical compatibility testing are very important. You must guarantee confidentiality at all times. Your legal team will have to look into non-disclosure agreements. The counselor, the intending couple, the nurse that you're going to have, everybody must sign a non-disclosure agreement. It will help to build confidence in the process. And I already mentioned that you cannot use the results to prevent them from getting married. So when you want to set up a medical compatibility unit, I hope I am not going too fast.
No, not at all. We are moving with you. We are with you, ma'am.
All right. Okay, thank you. All right, so when you want to set up a medical compatibility unit, I would suggest that you set it up as part of your counseling program. That way, you reduce your overhead on infrastructure. And for your counseling program, you already have counselors who would also be useful for your medical compatibility counseling. So you need personnel, you need your counselors, you need a nurse, because some of this information that I have given is actually a bit technical, I admit. But a nurse can look at the results and explain to the couple the implications. If it is something that she can handle, then she can explain to them that, well, for this is what you can do. For this, you actually, and if it's something that needs treatment, she can make an appropriate referral because she will be able to advise on the best level of healthcare they can attend. You need forms, you need your screening checklist, You need a place where you are going to enter the results, your non-disclosure agreements, and you must guarantee confidentiality of your forms, security of your forms. So whether you want to do paperless or you want to do the paper drought, it is important that you guarantee security of your forms. Then you must ensure privacy. You need a nice, decent, dignifying environment. This is not the kind of thing that you do at Asalatu and then you call the couple to a corner where anybody passing by can overhear them wittingly or unwittingly. You must have an environment that guarantees privacy. I would even suggest that you do an appointment basis so that people do not run the risk of running into one another. So you can give some time between appointments. Then another thing is that when you're setting this up, you need to identify a reliable, standardized testing center. And for us, when we talk about a standard laboratory, we're talking about a laboratory that has ISO 15189. If this laboratory does not meet that standard, then there's no use. Let me give an example. Somebody is AS, and because he was tested in a lab that was not standard, he was told that he was AA. He went on to marry somebody who was AS, and they went on to have sickle cell children. This man has done his due diligence, in all fairness to him. Who failed him is the counseling team that did not recommend him to a standard lab. And I see this every day in clinic. I find children having sickle cell and their parents actually did testing before they got married. Some of them even still have their tests and it shows that they were AA, whereas they were AS. So you must identify a standard lab. So medical compatibility is very important. However, it is not a guarantee of a happy marriage. Neither is it a guarantee that the couple will be blessed with children. Only Allah gives children, and only Allah gives marital happiness. We are just doing our due diligence to make sure that we avoid any other eventualities. It's unfortunate my slides were not put up because I had some case studies for you. But when you share the materials, please go through the case studies. I want you to try your hands on them so that you familiarize yourself with the material and gain some knowledge. So I have come to the end. I am very happy to take questions. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh. We can only say what a well-delivered presentation. Thank you very much. You are very happy to take questions. We are also very happy to have listened to you because the short session we've had with you has been a fulfilling one. Thank you very much. May Allah subhanahu wa ta'ala preserve you for greater service to the deen. Thank you very much, Ajia. There you have it, Dr. Khadija speaking to us on medical compatibility in marriage. What a brilliant message that was. Now we can take 2 or 3 questions before we call it a day. It's almost Maghrib time. So we've listened to Doctor. She's been speaking to us on medical compatibility in marriage. Honestly, it's a very topical issue, very contemporary topic. So let's think about questions that we have or some gray areas that we need to shed more light on or to demystify for us before we call it a day. So, but I would like us to keep the questions within the scope of the message that she has delivered to us today. So now, so if you have a question, you can just raise your hand in order to make it orderly so that our session is not rowdy. You can raise your hand or you can drop your question in the chat box, please. I'm watching. Nobody has raised his hand. It appears the message is well understood. Question? Okay, I guess the message was well delivered, and it has been well received. Alhamdulillah Rabbil Alameen. For Alhamdulillah, we've had a very rewarding session. I wish the CM was here today. We'll have been proud of this brilliant message that you've delivered to us. May Allah subhanahu wa ta'ala continue to use you for the ummah.
There's a hand up.
Okay, really? I haven't seen that.
I saw a hand up.
No, I can't see that from my end here.
All right, okay.
It has been dropped. It has been dropped.
Call out the name. It's all right, okay.
It was from one in Iran before, but I guess it dropped his hand again.
Okay. So I was saying that the chief missioner will have been proud of you if he was here, but on his behalf, we are all proud of you. On behalf of Nasrat, we are proud of this message that you've delivered to us. Honestly, let me say that the essence of this webinar is not just for us to come around and listen to a brilliant discussion or a brilliant lecture. It is for us to also find a way to step down the message passed here today to other people. Because quite a number of people are guilty of this. We go into blind love. I love this person. I love that person and all that. And then we don't bother to check whether we are medically compatible. Honestly, this is very important. At the end of the day, after marriage, you come to realize that there are issues, and even some of the children that will be produced by the marriage will also have medical complications, which they are not responsible for. In fact, some parents will have to answer to some questions before allowing the day of judgment, because some parents are actually responsible for the diseases or complications that their children are having today, and it is due to blind love. Blind love. You are meeting where you shouldn't meet. So we are Muslims, and then we should be driven by knowledge. We are not meant to be people of ignorance. We are not meant to be people who are blinded by infatuation, blind love. So I will call on Imam Olaguju, the chairman of the webinar committee, to give brief closing remarks. Bismillah, Imam. Imam Olaguchu, please unmute yourself and give our closing remarks. I guess a lot of people are having network glitches today. Dr. Moise Ajibade, please give closing remarks. Dr. Moise Ajibade? Okay, he may not be able to do that. Okay, now go ahead. Salam wa rahmatullahi wa barakatuh.
Alhamdulillah Rabbil Alameen wa salatu wa salam ala Rasulil Kareem. We thank Allah subhanahu wa ta'ala. May Allah continue to bless Muhammad sallallahu alayhi wa sallam. We, on behalf of the Chief Missioner, the National Mission Board of NASFAT, the BOT, the NEC, the Council of Elders, our Women of Al-Jannah, and the Administrative Department of NASFAT, I want to appreciate our Hajia, our doctor, our lecturer today, Hajia Khadija. In fact, I was listening to her, and Wallahi Azim, I was carried away, and very impressive lecture. In fact, I'm hearing some things for the first time, and I hope in myself, and I feel I would like to follow some steps mentioned in the lecture, inshallah. That's my own personal, interesting area. So I want to say you have made us happy, and you have given us a plus in our joy today in NASFAT by giving us, as brief as the lecture is, we enjoyed it so much. So, and by the time we even read over the material you have sent, I know we also gain more comprehensive aspect of the lecture. I want to thank you on behalf of everybody on the platform today. And this is what we do in NASFAT. We are proud to do this. This is an arena of knowledge. This is an arena of improving oneself in Islam, in the Deen, and not only in the spiritual now in NASFAT. We are already working towards improving ourselves on all endeavors of human. And I want to believe Allah subhanahu wa ta'ala we make us to have the cause to say Alhamdulillah as the all of all things. This webinar comes up every week and is an interesting aspect of our effort towards improving the Deen and human and well-being. May Allah continue to strengthen the drivers of NASFAT. And for our lecturer today, may Allah continue to increase you in knowledge. May Allah continue to make you triumph in your endeavors. La ilaha illallah, Muhammad Rasulullah. I know the chairman of the committee and the committee itself, they have one certificate to be presented, a certificate of appreciation to be presented for the lecturer. I know they will do that in due course. Thank you so much. We really appreciate you. Assalamu alaikum wa rahmatullahi wa barakatuh.
Wa alaikum assalam wa rahmatullahi wa barakatuh. Dr. Moizuddin, thank you very much for the opening, for the closing remarks rather. So before we draw the curtain on the program, we also like to have a closing dua. We started with dua. We should also end it with dua. But before then, let me further remind us, like Doctor has said, this is a weekly program. It is our program. It is a program that is open to all Muslims. Next week, we want to have more than 100 participants. Let's do it together. We can do it. We can do it. It's not something that the committee alone can do. We need everybody, the missioners of NASFAT, even Muslims who are not members of NASFAT. We all need to make a lot of publicity. We need to create a lot of awareness about this program. Honestly, just imagine what we just listened to now, the quality of the lecture we just listened to now. This is not a lecture that 3 or 4 or 20 people listen to. We need thousands and thousands of people to come around them and join us on this webinar. So thank you, everyone. We hope that you'll do this for us. So let me now call on one of our imams to give us the closing dua. Imam Mustafa Akinpelu Abiodun, closing dua, please. Imam Mustafa Akinpelu. I hope you can. Okay, now please unmute yourself and speak. Yes.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم اللهم ربنا لا تزغ قلوبنا بعد إذ هديتنا وهب لنا من لدنك رحمة إنك أنت الوهاب ربنا ظلمنا أنفسنا وإن لم تغفر لنا وترحمنا لنكونن من الخاسرين سبحان ربك رب العزة عما يصفون وسلام على المرسلين والحمد لله رب العالمين صلوا على النبي.
Thank you very much. See you again next week, same time. Assalamu alaikum wa rahmatullahi wa barakatuh.